right, everyone, let's get right into it today. We're tackling something that I know a lot of you are curious about. It's one of those things you see all over, promises to make you feel younger. Heck, maybe even reverse aging itself.
And that's where the skepticism kicks in, right?
Totally. Is
Yeah.
there actual science behind it? Or is it just hype and clever marketing?
Well, that's exactly what we're diving deep into today.
We're talking about hyperbaric oxygen therapy, or HBOT. Is it genuinely a breakthrough for anti-aging, or just another pricey trend?
That's the million-dollar question, isn't it? And we've gathered a ton of info to try and answer it.
We'll cover exactly what HBOT is, its recognized medical uses, and then the juicy part will unpack all those claims about its anti-aging potential.
Ready to separate fact from fiction.
I am. But before we get ahead of ourselves, let's start with the basics for anyone who's new to this. What actually happens during an HBOT session? Like, what are you actually doing?
Okay, so picture this. You're inside this specialized chamber. It's pressurized, meaning the air pressure inside is way higher than what we normally experience.
So you're not just breathing regular air.
No, you're breathing pure oxygen. And because of that increased pressure, the oxygen dissolves directly into your blood plasma.
Blood plasma, that's the liquid part of our blood.
Exactly. It also goes into your tissues and even this cerebrospinal fluid that surrounds your brain and spinal cord. Think of it like this normally. Oxygen attaches to hemoglobin in our red blood cells to travel through the body. But under pressure, we can supercharge things.
Get that oxygen everywhere it needs to go.
Right, so it's like a super dose of oxygen flooding your system.
Interesting. So this isn't some newfangled, unproven concept. We're not talking about experimental science fiction here.
Not at all. HBOT has been around for a while. It's a well-established treatment for certain medical conditions.
Like what kind of conditions are we talking about?
Decompression sickness, which divers experience. It's also used for chronic wounds that are resistant to healing. Things like diabetic foot ulcers.
Makes sense. Oxygen is crucial for healing.
It also treats carbon monoxide poisoning and even helps with recovery from traumatic brain injuries.
So it has some serious medical street cred, that's for sure.
Absolutely. It's a powerful tool when used appropriately.
But today, we're putting on our anti-aging hats, right? We're scrutinizing those claims about HBOT's potential to turn back the clock.
We're going to look at its possible effects on stem cells, those telomeres we always hear about, inflammation, and even brain function.
We want to give everyone a clear, science-based picture of what's really going on here.
Let's start with this idea of stem cells and tissue repair. We all know oxygen is essential for our cells to function. So what's the link between HBOT and stem cells?
Well, the research we dug into suggests that HBOT can boost the number of stem cells circulating in our bodies.
And why are stem cells so important?
Because they're like our body's internal repair team. They're crucial for healing injuries and fixing damaged tissues.
So in those specific instances, healing wounds, recovering from injuries, HBOT can give our stem cells a boost. It makes sense.
Yeah, but can it actually reverse aging systemically throughout the entire body? That's where the question mark hangs, isn't it?
Exactly. It might be great for healing specific areas, but whether it can actively rejuvenate aging tissues everywhere is still up for debate.
More research is needed.
Definitely. Now let's move on to inflammation. We hear all the time about how chronic inflammation contributes to so many age-related diseases. So how does HBOT fit into this picture?
Well, the studies we reviewed show that HBOT can actually reduce oxidative stress and inflammation, especially for those conditions we already talked about, like brain injuries and chronic wounds.
Right, and lowering inflammation in general could definitely have positive effects on overall health as we age.
But there's a catch. Most of the research is focused on specific medical conditions. We need more studies on the long-term anti-inflammatory effects of HBOT in, well, just regular aging folks.
That's a critical point. We can't make sweeping statements about HBOT being an anti-inflammatory cure-all for everyone just yet.
Now, for the buzzy topic telomeres, what did our sources have to say about the relationship between HBOT and these telomeres?
Oh, this is where things get really interesting. A 2020 study found that after a series of HBOT sessions, healthy older adults saw their telomeres increase in length by about 20%.
Wow, 20%. That's pretty significant.
Oh, and they also experienced a reduction in those senescent cells. Those are the cells that have stopped dividing and can cause inflammation and tissue problems.
I mean, we know telomeres are like those protective caps on our chromosomes.
And they get shorter as we age.
So lengthening them seems like a pretty big deal, a real breakthrough.
It definitely got people excited, but there are some caveats.
Always caveats, right? It's never that simple.
First, telomere length is just one piece of the aging puzzle. It's not the whole story.
So even if they get longer, it doesn't automatically mean we've cracked the code to reverse aging.
Exactly. And the second caveat, that study was pretty small. We need larger, long-term studies to confirm those findings.
To see if those longer telomeres actually translate into a longer, healthier life.
Right. So it's a promising avenue, but not a definitive answer. More like a giant arrow pointing towards more research needed.
Okay, let's shift gears to the brain. We touched on HBOT for brain injury recovery. But what about its potential to improve cognitive function in older adults more broadly?
Well, it's definitely shown benefits for things like stroke rehab and mild cognitive impairment.
There are cases where people have seen improvements in memory, focus, even that neuroplasticity, the brain's ability to adapt and form new connections.
It's incredible to see those changes in people who were already experiencing cognitive issues. But the research on cognitive enhancement in healthy individuals isn't quite as strong.
So even if someone says they feel sharper after HBOT, that doesn't mean there's solid scientific evidence to back that up, at least not yet.
It's more promising for specific neurological conditions, not a general brain booster for everyone.
Speaking of claims that might be a bit ahead of the science, what about HBOT and its effects on skin? We see a lot of marketing around HBOT for wrinkles and collagen production. What's the real story?
Yeah, this is where the marketing might be getting a little carried away.
Like jumping the gun a bit?
A little bit, yeah. Of course, oxygen is essential for healthy skin. It helps with tissue repair and all that. But our research didn't find any strong clinical trials showing significant wrinkle reduction or skin tightening from HBOT alone.
So those claims of HBOT giving you that youthful glow might be a bit exaggerated.
More wishful thinking than proven science, at least for now.
Okay, so we've covered a lot. Let's zoom out and look at the big picture. Is HBOT that magical fountain of youth we all dream about?
Based on everything we've explored, it's probably more accurate to say, not quite. It has those solid medical uses. And there's definitely potential in areas like inflammation, brain health in specific cases, maybe even influencing some aging processes.
But it's not a cure-all, not a one-stop shop for stopping or reversing aging.
And it's really important for people to realize that a lot of the bold anti-aging claims out there are based on limited studies or are just straight up exaggerated.
So for our listeners who might be considering HBOT, what are some practical things they should keep in mind? What are the realities of this therapy?
First, safety. HBOT is generally safe when it's administered by qualified professionals.
So finding a reputable provider is crucial.
Yeah. But there are potential risks.
Right.
Things like ear pressure problems and rarely oxygen toxicity.
Right. You have to weigh the potential benefits with the risks.
And the second thing to consider is cost. It's not cheap. And most insurance plans won't cover it unless it's for those specific medical conditions we talked about.
So thinking you can just pop into an HBOT chamber for general wellness and have your insurance foot the bill is probably not realistic.
Not at this point, no. And finally, it's important to remember that the strongest evidence for HBOT is still for wound healing and inflammation reduction in specific medical contexts.
So those are the areas where it shines. The anti-aging stuff is still in its early stages, and we need more research.
Agreed.
So our deep dive into hyperbaric oxygen therapy shows us it's a powerful tool with real medical applications. There's a lot of excitement and potential in the anti-aging world, but let's not get ahead of ourselves. Those fountain of youth claims are definitely overblown.
It might play a helpful role in a broader approach to healthy aging,
Yeah.
but it's not a magic bullet.
Eating well, exercising, getting enough sleep, all those things are still crucial.
Absolutely, they're the foundation.
So here's something for everyone listening to ponder. When we say anti-aging, what are we really after? Is it living longer, feeling more vital, looking younger?
Or a mix of everything.
And after learning all about HBOT, what parts of aging are you most interested in understanding better? Or maybe even trying to influence with evidence-based approaches?
Lots to think about.
As always, thanks for joining us on this deep dive. We'll catch you in the next episode.
See you then.
Take care.